This video training series is courtesy of the County of San Diego Office of Emergency Services.
Every emergency call, every emergency run, every life saved starts with you, the first responder.
But what do you do when confronted with evacuees with needs who may pose a challenge to your typical training methods?
The following video is one of a series of 8. It's designed to educate you on the various visual cues, do's and don'ts, proper behaviors, mannerisms, and sensitivities relating to those members of our San Diego community with physical disabilities and assisted devices.
Our hope is that you learn as much as you can so that when lives are depending on quick thinking and fast maneuvering, you have the knowledge and training to make the best decision possible.
Hi, Louis. My name is Greg George. I'm a fire captain and paramedic with San Diego Fire Rescue. Very nice to meet you.
Nice to meet you too, Greg. As you said, I'm Louis Frick, and I'm the Executive Director of Access to Independence.
Louis, can you give me some examples of some of the physical disabilities or assistive devices that we might encounter as first responders?
Yeah, absolutely, and of course, it's an exhaustive list, but I'll give you some examples. I mean, certainly wheelchairs are sort of a starting point, and there are power wheelchairs like the one I use, and there are all varieties of those. There are manual wheelchairs, but there's also devices like scooters, another power device, but then you got walkers and canes, crutches, things like that. You got people that have service animals, which would also be something to consider. And then you've also got medical devices that are not necessarily going to be obvious. So, you know, colostomy bags, urinary bags, things like that.
What are some common myths and stereotypes that people assume about people with physical disabilities?
People often assume limitations that may not be there. So I'll use a wheelchair, maybe, you know, does he have cognitive issues? I mean, some of the myths are that, you know, if you have a disability, you can't do anything. So don't make any assumptions about that.
Fire department, we're evacuating the building. Anybody home? Hi.
Hello.
I'm with the fire department. We have a gas leak in the building and we need to get everybody out of the building.
Are there any specific do's or don'ts that we as first responders need to be aware of?
There are a lot of politically correct terms, you know, saying persons with disabilities and things like that. But in a crisis, it's really, you know, that's a lot of that goes out the window. I would say don't assume anything. Don't assume that the person can or can't do something. Engage them by finding out what they need and how they need it.
What can we do to help you to get out of the building?
Louis, do you have any key insights for communicating with somebody with a physical disability in the course of doing an evacuation?
I think the first thing to say would be, you know, what can we do to help you? You know, what is it we can help you with, or how can we best help you? Because the person with a disability in most cases understands far better what their own needs are and how they can be met. And also, is there something else that we should know that's not obvious? You know, what else do you need to explain to me? What else do we need to know to best address your needs?
Is there anything else we need to get? Some medications? Anything else we need to do to help?
No, I think I'm good. I don't have medications or anything.
Okay.
I have my wallet and stuff. Can I take that with me?
Absolutely, you can take your
Engage the person. I think that's always the best approach, is to, you know, what can we do to help you? Here's what I have to do. What's going to work best for you?
But we're going to put you in this chair. So we'll take your wallet, we'll take, you know, emergency stuff.
What generally is good practice on our part to make sure that we're doing right by you in terms of your equipment?
You know, a lot of people are very protective of their equipment because it's how they get around. So
I can't have my chair with me.
Well, not with you, but we will have a crew come up and get it after.
Yeah, because I can't be without this for very long. I can't get around or anything.
You know, it's kind of my sole means of transportation. So understanding that you're going to have to get me out of it and move me in some other vehicle, my concern would be, hey, how are you going to get my chair there? Because I would definitely want my chair going wherever I am, though understanding it probably isn't going to go with me.
They will come back, though.
Absolutely.
Oh, okay.
So we will get it for you.
Okay, good.
But right now we need to evacuate you out of this building. Is there anything else we need to take for your chair?
Everybody's equipment is different. So like, again, if it was my situation and say you have to get me on a gurney or get me into, a vehicle or something like that, I would be telling you right away, assuming I was able to, here's how you disengage the motors.
Yeah, if someone's gonna push it, I guess you could disconnect the motors.
Okay.
Back there.
Right in the
on
back?
each side, yeah, there's a flap that you
Right here?
pull
Okay,
back,
I see
yeah.
that, yes, okay.
Just pull those out.
Okay.
On each side,
I
that
can get
disengages
that.
the motors, so.
Okay, yeah. we'll do that.
My chair is heavy, 300 plus pounds. So, it weighs this much. This is how you can move it freely.
Louis, are there any specific dangers that assistive devices might pose to either the individual or the first responder?
Possibly. That would likely be something that's not visible. So like a colostomy bag or a catheter, urinary type stuff. Those would be the kinds of things that could injure the person if you move them without saying how best can we move you, or what do I need to know about your situation.
Okay, so we're gonna put you in this chair. I'm just gonna lift you up.
Yeah, I have a colostomy bag. So speak
Okay, we'll get the
that.
colostomy bag,
Just
we'll get
kinda
that set
behind
up.
my legs and back
Okay,
there.
ready? Here we go.
Yeah.
It's not likely that the first responder is going to get injured, other than like trying to move a huge piece of equipment like a 300-pound wheelchair. I mean, these things have tremendous force and torque, and wheelchair really could hurt somebody if they just hit the joystick, especially without someone in it or not knowing how to drive it. That would be a danger to a first responder, and a pretty real one.
What can we do to make sure that we're respectful, but yet take care of what needs to be done quickly?
Very often, you have to know how to work things on the fly. And so I would imagine that as a person with a physical disability, I'd be in good hands with a first responder in the sense that they're going to be quickly kind of looking at the whole picture. And I would imagine that that's a real skill that you hone. Again, people with physical disabilities are often good problem solvers because they have to be by design, and engaging the person as you would anybody else, in the sense that they're a person first, and by the way, they have a disability as well.
Got it.
Louis, I really appreciate this opportunity to talk about dealing with the needs of people with physical disabilities and assisted devices. This is going to be very helpful for us as first responders.
Well, thank you, because as a person that may be on the other end of that, I'm happy to be able to help educate people about that, especially first responders. So thanks for the opportunity as well. It's been a pleasure.
This concludes the physically disabled and assisted devices video for first responders.
For more information, please contact Access to Independence of San Diego at 619-293-3500.
I'm Tony Meacham, San Diego County Fire Chief.
I'm Shelley Zimmerman, Chief of Police of the San Diego Police Department. Thank you for watching.